Hi, I'm Dr. Amir, and I'm going to be talking to you today about coronavirus. The reason we're going to even have this discussion today is because there's been some false information being put out there about breath holds to detect fibrosis, as well as swallowing water as though that would be enough in terms of the coronavirus entering the gut and being killed by the gastric juices. These are nice thoughts, but they're just not founded in truth. So we're going to talk about coronavirus disease 2019, COVID-19. Today we're going to reject fear. We're going to proceed with caution, attain the knowledge, apply that knowledge, and maintain hope. So what is coronavirus? Coronaviruses are a large family of viruses that are common in people and in many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses infect people and then spread between people, as we've seen with the severe acute respiratory syndrome coronavirus back in 2002, which ended in 2004. And then we saw the Middle East respiratory syndrome coronavirus, which was 2012 is when it began. And we still see cases here and there. In fact, I think we had 2 cases in 2019 here in the US. Now, severe acute respiratory syndrome coronavirus 2, this new virus, aka COVID-19, aka coronavirus, is in fact a beta coronavirus. This is also true of the previous outbreak of the MERS-CoV-2, as the MERS-CoV virus and the SARS virus before it. Now, all 3 of these viruses bear their origin in bats. In fact, the sequences from U.S. patients are similar to the one that China initially posted, suggesting a likely single recent emergence of this virus from an animal reservoir. And in fact, when it was tested, we found that it was 99 and some odd percent identified with bat, with coronavirus that we see in bat. And additionally, we found that the pangolin had pretty much the same virus, 99+% identical to the virus from the bat. So what we think happened is that perhaps the bat shed droppings somewhere. The pangolin basically came into contact with the bat droppings. And then what we know about this pangolin, this small anteater-like animal, is that it is eaten and sold on the black market. Okay, so pangolin meat usually goes for $2,200 per pound, and so with that understanding, that's likely what happened in Wuhan, China. It could be seafood still. There's still a chance that the bat came in contact with seafood, but more than likely it's the pangolin. And when you add all these things together, it equals a human infected with coronavirus. We're not going to provide a picture here because anybody can get it, and we're not trying to contribute to stigma, which we'll talk about later. All right. So what's been on the news right now? Well, everybody, we want to talk about Spanish flu back in 1918 that had a 10 to 20% mortality rate. And then we want to talk about that versus our common seasonal flu that we deal with every year, with a mortality rate of under 0.1%. And then we want to talk about the coronavirus, which has 127,125 infected, 4,700 deaths, and a mortality rate of 3.72%. And this was a few days ago, a week, less than a week ago. And so when we see these things, we say, well, it's not as quite as bad as the Spanish flu, but this thing is pretty bad. It's much worse, if you will, than the seasonal flu. Even though there's a higher amount of people who have been infected by the seasonal flu, and even though the deaths are much more, everybody wants to talk about the mortality rate, and that's fine. We do need to talk about it, but at the same time, we want to understand this pandemic in context. Okay, So there are 137,456 cases worldwide. With a world population of 7.77 billion, that brings us to 0.00176% of the world's population is infected. In other words, way less than 1%. There have been 5,074 total deaths, bringing the current. This is more current as of 10:30 this morning. The world mortality rate to 3.69%. Okay. And the mortality rate being those who have been infected have in fact passed away. All right. Now, the majority of these cases, 91% of these cases are found in China, Italy, Iran, South Korea, Spain, Germany, and France. If we start thinking about it in terms of the United States, which is my focus here today, I mean, I do empathize with those around the world. I empathize and sympathize with those around the world. But here today, we're focusing on the United States. We see that 1.237% of cases, of the total cases around the world, are found in the United States. So these 1,701 cases amount for, you can see this very, very, very small percentage of the world population is in fact infected in this country. And the USA in and of itself has had 40 total deaths with a mortality rate of 2.35%. And this is still, it's lower than the world mortality rate, but it's still concerning, right? Well, again, context is everything. So if you subtract the 457 confirmed cases and 31 deaths in Washington State, there are 1,244 confirmed cases and 9 deaths elsewhere in the United States. In other words, less than 1% of those who have been infected anywhere in the U.S. besides Washington have died. Now, what do we know about Washington? Washington was the first, in Washington State, in Seattle, was the first case that we saw here in the United States. So the response time is different. And in fact, we saw clusters. Okay. So the response time is different because it's the first case that we've seen in the United States. And we're talking about nursing homes. So we're talking about multiple deaths stemming from one set of exposures, if you will, one incidence of exposure, if you will. Okay. One small time frame of exposure. So when you really get things in context, we're sitting around less than 1% of a mortality rate in the United States in places where we've had an opportunity to be able to respond. Now, all this data is, of course, current as of this morning at 10:30, but I really wanted to bring that home because it is bad. It is something we need to take serious, but sometimes we can get a false impression of what those numbers look like, and it can cause us to operate in panic and fear. We need to respect the fact that there's this virus and it's dangerous, but fear cannot lead us. We need to operate from a standpoint of knowledge and move forward in that. Now, how it spreads. COVID-19 is a new disease, and we're still learning how it spreads, the severity of the illness that it causes, and to what extent it may spread throughout the United States. Right? We're thinking that the virus is spreading mainly from person to person. It's between people who are in close contact with one another within about 6 feet, and through respiratory droplets that are produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby and possibly be inhaled into the lungs. Can someone spread the virus without being sick? Well, people are thought to be the most contagious when they are most symptomatic. In other words, those who are the sickest. Now, some spread might be possible before people show symptoms, and there have been reports of this occurring with this new coronavirus. But this is not thought to be the main way the virus spreads. Okay. And also you can see spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, and possibly their eyes. But this is not thought to be the main way the virus spreads. How easily a virus spreads from person to person can vary. Some viruses are highly contagious, which means they'll spread easily, like the measles. And then there are other viruses that don't spread as easily. Another factor is whether the spread is sustained, spreading continually without stopping. Okay, the virus that causes COVID-19 seems to be spreading easily and sustainably in the community, i.e., community spread in various areas in the United States. Community spread means people have been infected with the virus in an area, including some who are not sure how or where they became infected. Now, what are the symptoms of coronavirus? Okay, of this acute respiratory distress syndrome? Well, reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease. Okay. The following symptoms usually appear between 2 and 14 days after exposure. That's a fever, a cough, shortness of breath. Call your doctor if you develop symptoms or have been in contact with a person known to have COVID-19, close contact within 6 feet for a significant period of time. Or you've recently traveled from an area with widespread or ongoing community spread of COVID-19, i.e., China, Italy, South Korea, France, places of that nature, Iran. Okay. Now, we need to take steps to prevent illness. There is currently no vaccine to prevent coronavirus disease-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person. Again, I'm repeating a lot of information, but this is intentional. I want you to be able to pretty much be able to watch this one time and have that information kind of embedded in you. So between people who are in close contact with one another, again, close contact within about 6 feet, through respiratory droplets produced when a person coughs or sneezes, droplets can land in the mouth and noses of people nearby and can be inhaled into the lungs. Older adults and people who have severe underlying chronic medical conditions like heart disease, lung disease, diabetes, things of that nature seem to be at higher risk for developing more serious complications from COVID-19 illness. So somebody who's on chemotherapy or something like that, those kind of people, we need a person with HIV/AIDS that's less controlled and a lower T cell count. We need to keep those kind of people in mind. We need to be very, very careful for those people. Please consult with your healthcare provider about additional steps you may be able to take to protect yourself. Now let's take some steps to protect ourselves. Let's clean our hands often. Wash our hands with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If you've been touching your face as well, those kind of things. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. I recommend getting like 70%. Or 90%, somewhere in there. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, mouth with unwashed hands. Okay? Avoid close contact. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. You can obtain this kind of information by looking at Hopkins coronavirus map, and that gives you some hints. And there are some other ones out there that are pretty good. This is especially important for my people who are at higher risk of getting very sick. You know, my people with sickle cell, people with diabetes, heart disease, lung disease, you name it, the chemotherapy, on chemotherapy for cancer treatment. All right. Take steps to protect others. Stay home if you're sick, except when you need to get medical care. Learn what to do if you are sick, and we're going to cover that in a few minutes. You want to cover coughs and sneezes. Cover your mouth and your nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw away used tissues into the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap or water not readily available, again, hand sanitizer 60% or more. Wear a face mask if you're sick. If you are sick, you should wear a face mask when you're around other people, whether it's sharing a room, sharing a vehicle, or just in any kind of close quarters. Like, for example, if you're in military barracks or something like that, you want to be using a face mask when you're close by. Before you enter a healthcare provider's office. If you're not able to wear a face mask, for example, because maybe you've been having difficulty breathing, then you should do your best to cover your coughs and sneezes. And people who are caring for you should wear that face mask if they enter your room. If you're not sick, you don't need to wear a face mask unless you're caring for someone who is sick and they're for some reason not able to wear a face mask. Face masks may be in short supply and should be saved for caregivers. And in fact, we know that they are currently in short supply. All right. We want to clean and disinfect. This is extremely important. We want to clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. So there's cleaning and there's disinfection. So disinfecting. So to disinfect, we're going to use EPA registered household disinfectants. Okay. We want to use the disinfectants appropriate for the surface, right? Options include diluting the household bleach, and you can make a bleach solution, third cup of bleach, and put it in a gallon of water, or 4 teaspoons of bleach per quart of water. Okay, and then we want to follow the manufacturer's instructions for application and proper ventilation. We want to check to make sure that the product is not past its expiration date. Never mix household bleach with ammonia or any other cleanser. Unexpired household bleach will be effective against coronaviruses when properly diluted. And we also want to talk about alcohol solutions. Ensure that solution has at least 70% alcohol. So even me with the hand sanitizer, I want my hand sanitizer to be 70% or greater of alcohol for the same thought process. Okay, other common EPA registered household disinfectants, products with EPA approved emergent viral pathogen claims are expected to be effective against COVID-19 based on data for harder to kill viruses. Okay, again, we want to follow the manufacturer's instructions for all cleaning and disinfection products. Now, just to go through a couple of them, we're not going to spend much time here at all, but you can see Clorox on the list over here on your right. You can see quite a few different choices, and this is available on the CDC website. In fact, most of these slides are exactly from the CDC website, just for clarity's sake. You see, so we see Clorox, we see a lot of Lysol products as well. And so those are the main things. I mean, we want to use Clorox and we want to use Lysol. We want to use bleach. We want to use high-powered alcohol. But you can go there for this list and figure out what it is that you want to do, what it is that you want to use. Now, what should you do if you're sick? Call your doctor. If you think you've been exposed to COVID-19 and develop a fever or symptoms of a respiratory illness, such as a cough or difficulty breathing, call your healthcare provider immediately. It's better to err on the side of caution than to ignore it and, infect a whole lot of people and not be treated. Okay. Now, steps to help prevent the spread of COVID-19. So if by some unfortunate situation you actually do become sick, or even suspect you're infected with the virus, you're going to stay at home except to get medical care. People who are mildly ill with COVID-19 are able to isolate at home during their illness. You should restrict activities outside your home except for getting medical care. You want to avoid public areas. Don't go to work, school, or public areas. Again, you might have to get a doctor's note or whatever, but with this current situation, I'm sure a lot of employers are going to be much more lenient. But you're going to want to avoid public transportation, ride sharing, or taxi use. You may need to segregate a little bit. You have to separate yourself from other people and animals in your home. Stay away from others. As much as you can, you should stay in a specific room and away from other people in your home. You should use a separate bathroom if possible. Okay. Limit contact with pets and animals. You should restrict contact with pets and other animals while you're sick with COVID-19, just like you would around other people. Although there have not been reports of pets or other animals becoming sick with it, it is still recommended that people sick with coronavirus limit contact with animals until more information is known about the virus. Whenever possible, have another family member of your household care for your animals while you're sick. If you're sick with coronavirus, avoid contact with your pet, including petting, snuggling, being kissed or licked, sharing food. If you must care for your pet or around animals while you're sick, wash your hands before and after you interact with your pets and wear a face mask. And this isn't just for COVID-19, by the way. This is for any viral illness. This is for being sick in general. These are good guidelines to follow, just to decrease the likelihood that the virus or whatever the ailment is spreads, right? Now, we want to call ahead, of course, before visiting our doctor. If we have a medical appointment, call the healthcare provider and tell them that you have or might have coronavirus. This will help the healthcare provider's office to take steps to keep other people from getting infected or exposed. In other words, like if you went to the hospital and you went to the ER and you were diagnosed with coronavirus, and somehow, some way you weren't kept and placed in some kind of quarantine, and you actually were able to go home because it was mild, you would want to call ahead of time to let your provider know when you get ready to do your follow-up visit that, hey, I was diagnosed as having coronavirus, and you want to the same courtesy you would want extended to you would want to extend to someone else. Now, wear a face mask if you're sick, okay? Especially when you're around other people, sharing a room or vehicle, pets, and before you enter a healthcare provider's office. Also, if you're caring for others, if the person who is sick is not able to wear a face mask because it causes trouble breathing, then people who live with the person who is sick should not stay in the same room with them, or they should wear a face mask if they enter a room with the person who is sick. Now, you want to cover your coughs and sneezes. You want to cover your mouth and nose with a tissue when you cough and sneeze. You want to throw those used tissues in a trash can. Wash your hands immediately with soap and water for at least 20 seconds. If soap and water, again, are not available, clean your hands with an alcohol-based hand sanitizer, 70% or above. It says 60%, but again, 70% or above. That gets you in the ballpark for cleaning surfaces and doing other things as well. Clean your hands often, 20 seconds. Especially after blowing your nose, coughing, or sneezing, going to the bathroom before eating or even preparing food. Again, 70% alcohol or more, okay? Covering all surfaces of your hands and rubbing them together until they are completely dry. Soap and water are the best option, especially if your hands are visibly dirty, okay? We want to avoid touching. Avoid touching your eyes, your nose, your mouth with unwashed hands. Avoid sharing personal household items. Don't share dishes, drinking glasses, cups, eating utensils, towels, bedding with other people or pets in your home. Wash thoroughly after use. Whenever you use these things, wash them with soap and water. Put them in the washer and dryer. Okay. Clean all high touch surfaces every day. Clean and disinfect. Remember, cleaning the soap and water, the bleach, those kind of things. And then we want to disinfect, our Clorox, our Lysol, those kind of things to disinfect. Okay. To actually kill off the virus. High touch surfaces include counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables. Okay. Disinfect areas with bodily fluids. Okay. Anything that might have blood, stool, or body fluids on them, we got to disinfect it. Household cleaners. We want to use a spray or a wipe according to the label instructions. Label contains instructions for safe and effective use of the cleaning product, including precautions you should take when applying the product, such as wearing gloves and making sure that you have good ventilation during use of the product. Monitor your symptoms. Okay, if you know that you have symptoms, ongoing symptoms, and there are signs that your illness is actually worsening, like you're starting to have difficulty breathing, call your doctor. Okay, call your health provider and tell them what you have and what you're being evaluated for. Okay, wear a face mask when you're sick. Again, before you enter this facility. This helps the provider's office to keep other people in the office or waiting room from getting infected or exposed. Okay, so that's important. Just wearing a face mask. Always think about not only your own health, but the health of those around you. Alert the health department. Ask your health provider to call the local or state health department. Persons who are placed under active monitoring or facilitated self-monitoring should follow instructions provided by their local health department or occupational health professionals as appropriate. Now, should you have a medical emergency, of course, dial 911. Notify the dispatch personnel that you have or are being evaluated for coronavirus. If possible, put on a face mask before emergency medical services arrive. Again, we want to be very conscious of those around us. When it gets to the point of discontinuing home isolation, patients with confirmed COVID-19 will remain under home isolation and precautions until risk of secondary transmission to others is thought to be low. Now, we've thought this to be a few weeks, but I think recently we were told that it could go up to 37 days post isolation that coronavirus can stick around. So we do want to be wise about it. Talk to your healthcare provider. The decision to continue home isolation precautions should be made on a case-by-case basis in consultation with healthcare providers and state and local health departments. Now, some extra tidbits. The fever, if you have fever, it can be subjective or confirmed. If you don't have a thermometer available, but you know that you're extremely warm, use that as part of your basis to make that call. Okay, we want to err on the side of caution. Close contact, again, within 6 feet for a prolonged period of time. Honestly, within 6 feet for a few minutes is enough for me to say, hey, err on the side of caution. While caring for, living with, visiting, or sharing a healthcare waiting area or room with a person who has coronavirus, or having direct contact with infectious secretions of someone who has coronavirus, i.e. being coughed on. If such contact occurs while not wearing recommended personal protective equipment, PPE, such as gowns, gloves, N95 respirator, goggles, eye protection of some sort, criteria for PUI consideration are met. Okay, so let's think about that. Now, with all these things being said, we have to think about mental health in terms of the coronavirus, because oftentimes mental health is something that is neglected when it comes to all types of disease, because mental health or mental illness, if you will co-occur with other illnesses. Okay, so what we're going to talk about right now is stigma, resilience, and mental health. Stigma occurs when people associate a risk with a specific people, place, or thing, like a minority population group, and there is no evidence that the risk is greater in that group than in the general population. Stigmatization is especially common in disease outbreaks. Now, resilience, that's the ability to withstand and recover from stress. Now, mental health is defined by WHO, the World Health Organization, as a state of well-being in which a person realizes his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Okay? Some groups of people who may be experiencing stigma because of coronavirus right now here in the United States are people of Asian descent, people who have traveled, emergency responders, or healthcare professionals. Okay. And because there's this stigma there, we may jump to a conclusion that these people have coronavirus and all these kind of things. And when we treat people like that differently, what that causes is that causes a stigma to be there, that causes people to be uncomfortable. And when you spread that, now you have groups of people discriminating against other groups of people for perceived risk factors when anybody can get coronavirus. Now, stigma hurts everyone by creating fear or anger towards other people. Stigmatized groups may be subjected to social avoidance and rejection. There could be denials of health care, education, housing, or employment. Sometimes the fear can get so high that there's physical violence. And so what we want to do is we want to abate that. Because the truth is anybody could get coronavirus. No, there's nobody wearing a sign that says, I have coronavirus. So we need to be aware that jumping to these conclusions can be harmful and dangerous. All right. And this is for public health officials. We won't even talk about this. Now, mental health and coping during COVID-19. The outbreak of coronavirus disease 2019 may be stressful for people and communities. Fear and anxiety about a disease can be overwhelming and can cause strong emotions in both adults and children. Everyone reacts differently to stressful situations. The emotional impact of an emergency on a person can depend on the person's characteristics and experiences, the social and economic circumstances of the person and their community, and the availability of local resources. People can become more distressed if they receive repeated images or hear repeated reports about the outbreak in the media. So part of what I'm just going to recommend right now is that you limit how much of the coverage you watch, especially if you find yourself becoming more stressed, more anxious. It may be time to cut off the TV or close the computer. People who may respond more strongly to the stress of a crisis include people who have pre-existing mental health conditions, including problems with substance use. We can see this in children, and we have people who are helping with the response of coronavirus, like doctors and other healthcare providers, or even first responders, such as those in an ambulance, those in fire trucks, etc. All right. So reactions during infection disease outbreak can include fear and worry about your own health status and that of your loved ones who may have been exposed to coronavirus, changes in your sleep or eating patterns, difficulty sleeping or focusing, worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs. People with pre-existing mental health conditions should continue their treatment plans during an emergency and monitor for any new symptoms. If you need any additional information, the Substance Abuse and Mental Health Services Administration website has some pretty useful information. Coping with these feelings and getting help when you need it will help you, your family, your community recover from a disease. Connect with family, friends, and others in your community. Take care of yourself and each other, and know when and how to seek help. Call your healthcare provider if stress reactions interfere with your daily activities for several days in a row. Again, this is because we're concerned about acute stress reactions, acute periods of dealing with this stuff becoming a prolonged disease, a trauma in and of itself, okay? So we want to make sure that we're staying on top of our mental health. Things that you can do to support yourself. Again, cut off the TV. Avoid excessive exposure to media coverage of coronavirus. Take care of your body. Take deep breaths, stretch, or meditate. You're taking deep breaths because it'll help you calm down, not because you're going to detect fibrosis. Okay? Try to eat healthy, well-balanced meals, exercise regularly, and get plenty of sleep, and avoid alcohol and drugs. Make time to unwind and remind yourself that strong feelings will fade. Take breaks from watching, reading, listening to the news stories. It can be upsetting to hear about the crisis and see images repeatedly. Try to do some other activities you enjoy to return to your normal life. I mean, yes, this is all going on, and yes, we need to be concerned about it and observe and watchful, using wisdom. But at the same time, we still got to live life. So we want to make sure that we connect with others, share our concerns and how we're feeling with a friend or a family member, maintain healthy relationships, maintain a sense of hope and positive thinking, share facts about it with about coronavirus and the actual risk to others. Remember, here in the United States, it's like 2.35% mortality rate. There's 1,700 cases. If you subtract out Washington, we're talking about a 0.7% mortality rate. So yes, that's a high number, but it's not on the 4% level that we're seeing on the news. And most of the deaths have not occurred in this country. There have been 40 deaths in this country, 9 outside of Washington. So we need to know the actual risk that we are facing right here. Okay, we empathize and we partner with everybody across the world, but what we're dealing with right here is what we're dealing with right here. Now, people who have returned from areas of ongoing spread more than 14 days ago and do not have symptoms of COVID-19 do not put others at risk. Okay, we just need to make sure that we understand 2 basic principles. That's quarantine and social distancing. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. That's what quarantine is. Social distancing means remaining out of places where people meet or gather, including local public transportation, i.e. bus, subway, taxis, ride share, and maintaining distance, approximately 6 feet or 2 meters from others. Sharing accurate information can help calm fears in others and allow you to connect with them. For me, I probably will still go to church and places like that because that's who I am, and I'm not going to let this situation dictate that. But with that said, I'm going to take appropriate precautions as I go those places that I would like to go, and it's not just anywhere. It's the things that I do that are integral to my mental health. Right? I'm not going just anywhere. I'm not looking online and saying, there's cheap airplane tickets and trying to fly to other destinations. Understanding that you could be flying to a destination where there's not a disease outbreak, but maybe you're a carrier and you're bringing it over there. So let's be mindful of our neighbors around the world as well. All right. Now, for parents, children react in part on what they see from adults. Okay. When parents and caregivers deal with coronavirus calmly and confidently, they can provide the best support for their children. Parents can be more reassuring to others around them, especially children, if they are better prepared. Not all children respond to stress in the same way. Some common changes to watch for in children: excessive crying and irritation, returning to behaviors that they've outgrown, like they're having toileting accidents or bedwetting and they haven't been doing that. Excessive worry or sadness, unhealthy eating or sleeping habits, irritability and acting out. Okay, poor school performance or avoiding school, difficulty with attention and concentration, avoidance of activities enjoyed in the past, unexplained headaches or body pain, use of alcohol, tobacco, or other drugs. And remember, all these things are in context. You're comparing these things to before we started dealing with this to now, not saying, well, my kid has all these things, they must be affected by coronavirus. No, it has to do with where they were prior to learning and dealing with the changes that occur with coronavirus and now. Okay. There are many things you can do to support your child. Take time to talk to your child about the coronavirus outbreak. Answer questions and share facts about it in a way that your child can understand. Reassure your child that they're safe. Let them know it's okay if they feel a little upset. Share with them how you deal with your own stress so they can learn how to cope from you, if you have good coping mechanisms. Limit your child's exposure to media coverage of the event. Children may misinterpret what they hear and can be frightened by something they do not understand. Children may, in fact, have life events and activities that are altered as a result of coronavirus prevention, i.e., right now, a lot of kids are going to be getting out of school. There's also going to be a lot of cancellation of after school activities. All these things can affect them. So you may need to reassure them that everything will be okay and that it's okay for them to be a little disappointed. Okay. Because that's part of learning what life is. Help your child to have a sense of structure. Once it is safe to return to school or childcare, help them return to their regular activity. Be a role model. Take breaks, get plenty of sleep, exercise, and eat well. Connect with your friends and family members and rely on your social support system. This is for responders. Um, you need to be aware. You need to be aware, and you need to put on your own oxygen mask, right? Okay, if there's a plane that's going down into the water, you're instructed to put your own mask on first and then put on the mask of your neighbor. Why? Because if you're there and you're not taking the precautions that you need to take for yourself, you may find yourself in a world of hurt, and then you're not going to be able to help that person that's in need of your help. So the best way to help somebody else is to first help yourself. Okay. For people who have been released from quarantine, being separated from others, if a healthcare provider thinks you may have been exposed to coronavirus, can be stressful, even if you don't get sick. Typical reactions include mixed emotions, including relief after quarantine, fear and worry about your own health status and that of your loved ones who may have been exposed, stress from the experience of monitoring yourself or being monitored by others for signs and symptoms. Sometimes people can become a little hypervigilant or a little bit of obsessive compulsive just from having had to go through that experience. So be aware of those things. Sadness, anger, or frustration because friends or loved ones have unfounded fears of contracting the disease from contact with you, even though you've been determined not to be contagious. Again, it's all about the stigma. Once somebody has been said to have coronavirus, sometimes even after they're outside of a contagious period, there are those who may associate them with coronavirus and now have stigmatized them and treat them like a leper. And this is not the way we're to proceed. We need to be informed, and we need to govern ourselves accordingly from the information, okay, and not be driven by fear. Guilt about not being able to perform normal work or parenting duties during quarantine, or other emotional or mental health changes. Children may also feel upset or have other strong emotions if they or someone they know have been released from quarantine. You can help your child cope. Now, who's at higher risk of getting sick? So let's cover this really quickly. Older adults, people with heart disease, diabetes, lung disease. If the outbreak happens in your community, it could last for a long time. An outbreak is when a large number of people suddenly get sick. Depending on how severe the outbreak is, public health officials may recommend community actions to reduce people's risk of being exposed to COVID-19. And we've already been receiving some of those. Those actions can slow the spread and reduce the impact of disease. Remember, clean and disinfect. Wear your personal protective equipment. Be smart about where you go, and stop touching your face as much as possible. Okay. If you're at higher risk for serious illness from coronavirus because of your age, or you have serious a long-term health problem, it's important for you to take actions to reduce your risk of getting sick with the disease. Pregnant women, are they more susceptible to infection or at increased risk for severe illness, morbidity, mortality, as compared to the general public? The answer is we don't have information from published scientific reports at this moment about COVID-19 with regards to pregnant women. We do know that because of the immunologic and physiologic changes that occur during pregnancy, that a pregnant woman can become more susceptible to a viral respiratory infection, including coronavirus. They could be at risk for severe illness, morbidity, or mortality compared to general population, because we've seen it in SARS-CoV and we've seen it in MERS-CoV. Okay, so we do, and also, for example, influenza A. And so those kind of things we do need to keep in mind. Pregnant women should engage in usual preventive actions to avoid infections, like washing their hands often and avoiding people who are in fact sick. Now, are they at increased risk for adverse pregnancy outcomes? We don't have information about adverse pregnancy outcomes, Pregnancy loss, including miscarriage and stillbirth, has been observed in cases of infection with other related coronaviruses. Again, we've seen it in SARS coronavirus, and we've seen it in Middle Eastern respiratory syndrome coronavirus during pregnancy. And so we have reason to believe that, but we just don't have confirmation. But high fevers during the first trimester of pregnancy can increase the risk of certain birth defects. So we need to make sure that we're staying on top of those things. Are pregnant healthcare personnel at increased risk for adverse outcomes if they care for patients with COVID-19? The answer to that is they should follow risk assessment and infection control guidelines for healthcare personnel exposed to patients with suspected or confirmed COVID-19. If you adhere to these guidelines, you reduce the risk, right? We just want to make sure that we're doing that we have due diligence. So if you're pregnant and you're working in the hospital, or you're working around sick patients, you just want to make sure that you're consistent with protecting yourself. Put on your safety mask and then that of the next person. All right. Transmission during pregnancy or delivery. Common question is, can pregnant women pass the virus to their fetus or newborn? Okay. In other words, is there vertical transmission? We think that it's mainly spread through contact with an infected person through respiratory droplets. So we really don't know at this point. However, in limited recent case series of infants born to mothers with COVID-19 published in peer-reviewed literature, none of these infants have tested positive for the virus that causes coronavirus, okay? 19. Additionally, virus was not detected in samples of the amniotic fluid or breast milk, okay? So right now we would say that vertical transmission hasn't been reported. And even from the previous coronaviruses, we don't have much information, but it's looking like it's not vertically transmitted. All right. Are infants born to mothers with COVID-19 during pregnancy at increased risk for adverse outcomes? There are some cases among infants born to mothers positive for COVID-19 during pregnancy. However, it's not clear that these outcomes were related to maternal infection. In other words, it could have been for another reason, right? Given the limited information, knowledge of adverse outcomes for other respiratory viral infections may provide some information. Influenza has been associated with adverse neonatal outcomes such as low birth weight and preterm birth. Additionally, having a cold or influenza with high fever early in pregnancy may increase the risk of certain birth defects. Infants who have been born preterm or small for gestational age to mothers with other coronavirus infections, SARS-CoV and MERS-CoV during pregnancy, okay? So there have been some preterm and small for gestational age babies born to mothers with other coronavirus infections. So that's something to kind of keep in mind. Is there a risk that COVID-19 in pregnant women or neonate could have long-term effects on infant health and development that require clinical support beyond infancy? We don't have that information at this time, okay? But we know that prematurity and low birth weight do have adverse long-term health effects. So these are things to keep in mind. Again, we haven't had evidence that there has been transmission of the virus through breast milk. Okay, and really that's it. So just to kind of close this up, I want to thank you for your time. Remember the current current mortality rate in our country is 2.35%. If you subtract out Washington, which were the initial groups and bunches of cases, oftentimes that we had a hard time containing, because let's be honest, we had no idea what we were up against until we actually saw it ourselves. I mean, it's one thing to see it from afar and say, oh, we see that doing this or that over here, but it's another thing to experience it clinically and have to learn how to respond and what measures to take and all those things, especially when, it's the first case, right? And understand that outside of Washington, the mortality rate is less than 1%. Okay. So we just really have to keep that in mind. There have been 9 deaths outside of Washington. And when we look at other places who have encountered the virus at around the same time as us, or had incident cases at around similar times as us, there are places that are faring a lot worse. So there should be a level of gratitude, but let's also show concern. Let's flatten that curve together. Thank you.